The STA system is ideally suited for the administration of traditional injections like the buccal infiltration as well as the posterior superior alveolar nerve block. Let's discuss how to begin.
Injection technique, the supraperiosteal buccal infiltration. Set the wand system to the normal mode, which allows the wand system to function with two distinct flow rates, the controlled flow rate and the rapid flow rate. We recommend using the controlled flow rate for the first quarter of the cartridge for all initial phases of the infiltration and block injections. Depressing the foot control pedal lightly allows you to enter the controlled flow rate. Fully depressing the foot control allows you to enter the rapid flow rate. There is a corresponding beeping tone to distinguish these two rates that you will hear. It is important to remember that rapid flow is used during supraperiosteal buccal infiltration injections or mandibular blocks only after the first quarter cartridge has been dispensed and the patient has acknowledged that they have soft tissue anesthesia of the area being injected. To administer a supraperiosteal infiltration injection, we recommend the use of a 30-gauge 1-inch needle. Topical anesthetic may be used if you and your patient desire. Just prior to needle insertion, initiate cruise control by depressing the foot control lightly. After 3 beeps, the wand system will now be in cruise. Upon hearing the cruise announcement, remove your foot from the foot control pedal if you desire to use the cruise feature. This begins the anesthetic flow at the injection site. Hold the handpiece very delicately and insert the needle using a slight bidirectional rotation. Continue with the slow insertion, which may take several seconds to reach the target. If an aspiration test is required for the specific infiltration, perform the aspiration by depressing and releasing the foot control pedal. If the aspiration is negative, you can continue the infiltration injection and administration of anesthetic solution to the area. If aspiration is positive, reposition the needle and perform another aspiration by depressing and releasing the foot control pedal. Once you have achieved the negative aspiration, it is recommended that you administer at least 1/4 of the cartridge at the controlled flow rate before transitioning to the rapid flow rate. To enter into the rapid flow rate, depress the foot control pedal beyond the halfway down position. This will allow you to enter into the second, more rapid flow rate in which you can administer the remaining amount of anesthetic solution. This should only be used after your patient indicates that effective soft tissue anesthesia has occurred. When you have delivered the required dosage, you can remove the needle. To avoid anesthetic solution sprayback into the patient's mouth, perform the following. When the needle is still embedded in the patient's tissues, depress and release the foot control pedal. Count 3 beeps after releasing the foot control, then remove the needle from within the patient's mouth. Direct the needle away from the patient as a small amount of anesthetic solution may still be present. Should you require more than 1 anesthetic cartridge, you can reload subsequent cartridges and continue as required. Please see the section on multi-cartridge technique. The wand system precisely controls the flow rate and pressure, allowing you to consistently perform injections below your patient's pain threshold level, thus resulting in a more comfortable experience than what is possible with a traditional syringe. By increasing patient comfort, the wand increases patient satisfaction and builds loyalty. It is the sole responsibility of each practitioner to identify, select, and administer the proper drug and volume for a given patient. The following information serves as a suggestion and is not meant as definitive guidelines for any specific patient. The suggested drug and volume to perform the supraperiosteal buccal infiltration injection is 2% xylocaine HCl, 1/100,000th epinephrine, a drug volume of 0.9 ml to 1.4 ml, which is equivalent to 3/4 to 1/4 cartridge in the suggested volume when performing this infiltration. If you elect to use a 4% concentrated local anesthetic drug, such as 4% articaine HCl, use half the dosage previously suggested and use extreme caution when using these medications. Please refer to an appropriate textbook reference source for guidance and recommendations pertaining to local anesthetic solutions and specific volumes.
Buccal infiltrations can be easily and comfortably administered using the STA's normal mode with both the control flow and rapid flow rates.